something that the patients that use this, do they love this? I mean, do you have churn, or is it very low?
No, we have. That's a great question. The usage rate is low, but people who use it, like it, and use it again. In an ideal world, this would be driven by managed care and Medicare. They basically would impose higher costs on people for utilizing expensive brick-and-mortar healthcare, which would drive people to the cell phone and the internet in order to access their routine healthcare. But that hasn't happened yet.
The forces are going to push for efficiency eventually. I mean, there has been kind of a brick wall built around inefficient delivery methods. One of the things that I will often kind of talk about is that physicians in the future will be much more adept and much, they'll be managing technologies as opposed to really
Whoa, let's stop right there, Jeff. Why should physicians be managing technologies? Why not have technicians managing technology?
Well, and
why not have computers managing technology?
That's exactly why cosmetic medicine, why there's this overlap is because, and why there are lots of physicians moving into cosmetic medicine is because of a couple things. One is there's no third-party reimbursement, right? So it's a demand-driven. The other thing is that it is scalable. So if I have 6 treatment rooms and they're full, I will just add another piece of technology, get another technician, and I'm scaling because the physician is managing what is going on as opposed to delivering all the services themselves. That's in effect, what SwiftMD is doing in some respects too, where a physician is now not reliant upon people driving over and seeing him. He's actually able to kind of deliver services at a distance. And that, I would argue that there are some real similarities there. Would you agree with that?
I would agree with that. Although the people in the cosmetic market get to set prices in a way, and they run the difficulties with, you get to set their prices basically.
Well, that's true, except the competition demand.
No, you're right. No, you're right. That's an excellent point. Only the competition. It's more of a market. I would say cosmetic medicine is more market driven in terms of pricing structure. With SwiftMD, which the sale is really to third party payers. Since the consumers in general are not paying, the sale is to third party payers. So for this, we've had several RFPs from request for proposals from managed Medicaid. But if managed Medicaid is paying for $25 for an office visit, well, it's kind of hard for us to compete with that.
Let me ask you this: do you provide services? This seems like there's some overlap with concierge practices. Do you provide services, or have you seen that before, where you're providing telemedical services for concierge clinics or private kind of practice?
We would love to develop that, but we have 12. We have a little bit over 9,000 members. I'm aware of 12 of our members who have MDVIP, which is a leading premier healthcare and concierge service. I ask these people, why do you have us? Well, they have us because they see us as a complement. They're MDVIP doctors, a family doctor, and internist. They don't see the person necessarily knowing what to do in an emergency. So if they have an emergency, they want an emergency physician. If their child falls off a bicycle and has a chin laceration, that MDVIP doctor is not worth that much to them. So what they really want to know is, does it need to see a plastic surgeon? What should be done in the ER? So yeah, in the big picture, if we were successful on the scale of MDVIP, we would compete with that service. I actually think what we're doing would be superior. I mean, the MDVIP is kind of like the last stand, to my mind, of brick and mortar practice. Those guys. Well, that's unfair of them. But they're still delivering brick and mortar medicine as opposed to virtual medicine. Whereas, what we're doing is delivering virtual medicine.
Well, and it does seem to me kind of complementary, where you have this coverage where kind of first line of defense might be telemedicine. And then, if you're actually going to go see a physician and you don't want to wait in a waiting room, it might be a concierge practice. So I would guess that
the concierge doctors are still delivering a lot of care, which if people were rational, they wouldn't need. I mean, I have no problem with it. To my concierge medicine, it's like someone saying, Let's suppose the general problem is we want to put meat in someone's belly. Well, that's the conscious medicine is the equivalent of Smith and Walensky. The telemedicine is the equivalent of Burger King or McDonald's.
Sure.
If your problem is a urinary tract infection or an ankle sprain, I think everyone should have, if they have the money, should be able to go to their concierge doctor or the god of, urology, goddess of urology at Mayo, and spend whatever they want to. But what I'm trying to address here is actually a different problem, which is that I'm trying to get people to see that, you don't really need to be examined for that problem. Someone needs to ask the right questions. And then you don't really need to make an appointment or go to the expense of having a concierge doctor who can game the system for you. When telemedicine breaks down the barriers and can deliver cost-effective health care at a very low cost. After all, concierge medicine is expensive.
Elliot, you're going to be speaking at the Medical Fusion Conference down on November 5th in Las Vegas, Nevada, at the Wynn, I think it is. What are you going to be talking about there?
I'm going to be talking about the promise and potential of telemedicine and the current challenges to developing a career in telemedicine.
Well, that's it for this show. Thank you very, very much for listening. Hope you enjoyed it. Now, we would love to have feedback. So, of course, questions and comments, please send them along to the email, which is podcast@medicalspamd.com. Or you can leave a comment in the Physicians Forum on the medicalspamd.com website. Now, if you're a subscriber, that's great. But if you haven't, please do come along and subscribe. You can get this show downloaded automatically whenever there's a new episode. So just find Medical Spa MD on iTunes by searching for it, or visit the medicalspamd.com website and click on podcast, and there's some ways to subscribe there as well. Now, as always, please consider everything we say to be complete conjecture and random speculation, not medical or legal advice, and laws and regulations vary everywhere, so do consult a medical or legal professional before taking any action. So it's goodbye from me, Andy White.
And goodbye from me, Jeff Barson.
Wishing you all the best until we see you next time on Medical Spa MD.